All right, well, many women are either unaware of the symptoms to pay attention to for heart disease or may attribute their symptoms to other causes. We talked about it, stress, maybe panic attacks. Well, we're joined now by Dr. Badhey, an interventional cardiologist for Texas Health Hurst Euless Bedford. And he's going to give us some symptoms to look out for, right? In case you may not even know. And I'd love for you to talk about what men experience and what women experience and how they might differ.
Absolutely. And this is an awareness issue, and it's a very important topic that is up for discussion. We all grew up watching the show ER, where you see a patient come in with, classic chest pain. We had a gentleman earlier today, crushing your chest, raining down your left arm, short of breath. But that's not necessarily true in every case, and especially women. Women are known to have atypical symptoms, so they can present with shoulder pain, nausea, indigestion, back pain, and that's a big problem because, as you know, there's minutes count, seconds count, and there's a delay in recognition of symptoms, and so there's a delay in a higher death rate now in women than there is men.
That's right. And I heard about jaw pain, right?
Absolutely.
Well, how does jaw pain, why is that?
Well, there's a theory that the nerve innervation that supplies your heart has a supply to your jaw too, so that's why some people present with jaw pain as well.
And what advice do you give to people who have a genetic history? We've talked about my father and how he died very young from a heart attack. I do see a cardiologist every year just to get checked up. What advice do you give if someone has that genetic history of heart disease in the family?
So it's important to realize heart disease is not a have or have not condition. It's a continuum of cardiovascular risk factors. So the most important thing you can do is modify your risk factors. So if you're genetically prone, if you got a male member less than 55 or a female member less than 65 with heart disease, then you're prone. That's one factor. And there's other factors: diabetes, smoking, high cholesterol, lack of exercise, and so on and so forth. But the biggest thing you can do is talk to your primary care doctor and modify your risk factors. So if you're a smoker, quit smoking. If you're not exercising, exercise. Modify your diet. And then based on your risk, there's different risk calculators out there. There's a Framingham risk score. There's myheartage.com. There's various risk factors. And if you're at a higher risk, then you may be appropriate to be referred to a cardiologist for appropriate testing.
So definitely check with your doctor,
Absolutely.
Right? And what do you need to worry about with kids? Because I have a son and a daughter, but I'm always worried about my son and that maybe I've passed something down to him. At what point in time should I be discussing those things with his doctor?
Well, there's heart disease is a continuum of, well, the biggest risk factor is coronary artery disease, which is blocked arteries in your heart. And kids are very unlikely to develop that. There's different conditions that affect kids for sudden cardiac death, like hypertrophic cardiomyopathy, other things. But the most common cause is coronary artery disease. So I don't recommend screening kids. Is there a certain age? There's no specific cutoff to start, worrying about coronary artery disease, but I would suggest once you hit 30 to talk to your regular doctor.
Now, we hear a lot about it happening on athletic fields with teenagers, and everyone's always asking, where's the defibrillator? Make sure there's one around. I've always wondered, is that something I should think about having in my house?
No, the athletes is not. It's a different pathophysiological process. So you see people having heart attacks. That's from coronary artery disease, which is plaque buildup in the arteries. But athletes and other sudden deaths in children or young adults, especially athletes, is more of a structural heart problem. Whether you're born that way with a structural heart problem or electrical heart problem, and the death from that is not a heart attack but a heart arrhythmia.
Got it.
So I don't recommend necessarily that you have to have a defibrillator in every person's house. I think it's important to recognize symptoms and call help early.
So I think that's the takeaway from what we've got from the stories earlier and from what you're saying. If you're experiencing any of these symptoms, denial is a big factor in this, right? I'm fine, I'm not having a heart attack, but you're saying no matter what, pick up that phone and call 911.
Absolutely, and most unfortunate cases we see is because of delay of symptoms. And when I say seconds count, it's seconds count. I mean, all of us, we take call 24/7, and we live within 15 or 20 minutes of the hospital at any given time because seconds count. I mean, it's gotten to a point where, once the EMS arrives at your house and they think you're having a heart attack, even if they think it, they call us in. So we're actually at the hospital by the time you get there, and that shaves off a good 7 or 8 minutes. So it's very important. So don't be in denial. Better safe than sorry. And, heart disease is the #1 killer. It kills more people than the next 7 causes combined. And it's very, very important to realize that.
And every 33 seconds, someone dies from?
A cardiovascular death, absolutely. It's about 950,000 deaths a year. And if you do the math, 365 days, it's about every 34 seconds of
I
death.
literally just got chub. That's frightening to me. So just stay on top of it, stay healthy, have a plan with your doctor, and if you're experiencing any of these symptoms, which we'll have on our website, of course, call 911.
Absolutely.
Don't wait.
Don't be in denial and don't wait.
Oh, great tips. I'm just like freaking out right now. But up next on our Go Red for Women special, we are going to get our heart rate up, our cardio rate going, and burn a few calories this morning with some heart healthy exercise. Come on back.